Welcome back from Break Runners. Dr. Christina, Doctor of Physical Therapy and a runner, obviously. Just getting back from my run this morning. And with this humidity, I don't know about you, but when the weather changes, my asthma is affected. My allergies, my asthma, and my asthma is exercise-induced, allergy-induced, and stress-induced. So I've got a trifecta there. I don't know about you, but on humid days like this, it can feel a little helpful, but if I'm already having some difficulty breathing because of maybe some allergies, mucus, this humidity can really make it feel like I'm breathing out against a force that's like pushing in on my chest and not letting it come out. And I definitely noticed along the way that I had a couple of times where I was feeling my scalenes tighten up, which, if you didn't know, your scalene muscles can get really tight, especially in asthmatics when we're trying to lift up those rib cages to breathe, right? And so anyways, I know I've talked about it before, about how 360 breathing can be super helpful for asthmatics, not just pelvic floor patients, to be able to improve your tolerance of breathing while running or breathing in general, as you're doing everyday things. And so I just wanted to show you in a visual real time as I was running today what I did in real time when I started to notice those scalenes kicking in. So I'm running and notice that I'm starting to breathe in this direction as I'm running, all right? And one thing that I'll notice is, like, if I tend to push off my toes and get more vertical movement as I'm running, I might be more inclined to do those rib cage lifts, okay? So instead, I'm definitely gonna make sure that my force is going forward rather than up as I'm running to decrease the temptation to breathe up. I'm also going to not just breathe, into my chest and into this mid-back area to get more movement directly here, but really I got more relief when I got myself to breathe not just here, but down into my pelvic floor this way, okay? When I shot that air down this way, it felt like there was so much more room for the air to go down my whole back, all right, like this. Sorry, I was weight shifting. You shouldn't weight shift. Like this, and getting the air totally into my back, all right? Now, how do I do that? I am going to have to increase my core engagement. I'm going to have to pull in here to lengthen here, all right? Pulling in here doesn't just mean you cinch everything in. What it should mean is you're pulling in here to lengthen here, okay? And if you can get yourself to do that while you're running, while you're walking, while you're having an asthma attack, it can really take the stress and tension out of this area and bring it more rounded, elongated into this area and make it where you feel like you get a fuller, deeper breath. So try it out. Let me know if it works.